What is medical coding? In this video, I'm going to talk a little bit about the medical coding industry and go over some of the aspects of what medical coding is. So, medical coding is being able to convert a medical record that will consist of office notes or clinical notes, operative reports, radiology reports, lab reports, anesthesia services and convert that into a numeric code. So that numeric code comes from the CPT coding manual, which is one of the coding systems that is covered under HIPAA. So I'm going to talk a little bit about one of the body systems that we're going to be focusing on in the medical coding prep course. My name is Paula Anderson. I'm with Paula Anderson Coaching Consulting, and you're about to learn more about what medical coding is. So, integumentary is one of the body systems that we're going to be focusing on. So, this deals with the hair, the skin, the nails, and the sweat glands. So, this is going to be the anatomy that we'll be covering. Some of the different lesions that are covered or that are found within the integumentary system, you have a cyst, a fissure, a macle, nodule, papullae, a polyp, pustule, ulcer, vesicle, and wheat. So when you're coding in the integumentary system, you want to determine what type of lesion you're coding. So either you have a benign lesion, which is going to be non-cancerous, or you have a malignant lesion. Now, there's two things that you need to know once you determine what the type is. You need to know the size of the lesion, and then you need to know the location of the lesion. So if you would turn in your CPT coding manual and turn to your lesions in the integumentary body system, then you'll find these codes. So another area that you want to code in the integumentary system is going to be repairs. So we have three different types of repairs. We have simple, intermediate, and complex. So simple repairs, of course, is just a superficial repair. It's on the surface of the skin. It's bundled into the excision procedure, so it's not going to be billed separately. It involves the epidermis, the dermis, and subcutaneous tissue, and it's primary suturing. Intermediate is going to be more of a layered closure. So there's two or more layers that's being closed together. You can report intermediate codes separately. So if you bill for an excision and a repair, those two codes can be billed. However, you would have to put a modifier, one of those codes. So we teach you how to apply modifiers as well in the medical coding prep course. Complex repair. So that's going to be a deeper level of skin that you're going to repair. So medical coding is something where you really do have to want to research, you want to analyze, you want to um, understand the coding guidelines. So, some coding guidelines come from the Centers for Medicare and Medicaid Services, which is CMS. So, we have the National Correct Coding Initiative, and those edits actually give coding guidance as well as billing guidance for individuals that want to learn how to bill claims to Medicare. So, if you're interested in taking a step and getting into an industry that is expected to grow between 2024, I think it's 2034, I want you to go to my website, paulaandersononline.net. That's paulaandersononline.net. And I want you to learn a little bit more about me. So I'm going to tell you my own personal story as it relates to healthcare. So I started out in healthcare in 1987. So I was only 16 years old when I got into the industry. I didn't even know that medical coding was a profession, but I worked in this industry while I went to school, went to college. Once I became a mother, I was able to take care of my son while I was working in the industry. So I worked in billing for the majority of that time period. And then in 2002 is when I decided that I wanted to teach medical coding. So that's when I got my medical coding certification. So I've been a medical coder or certified professional coder since 2002. And then I got my instructor certification in 2017. So I've been an approved APC instructor since 2017. And in 2024, I decided to get the CPB, which is a Certified Professional Biller certification. So there are levels to medical coding. Now, one thing that I would stress is that just because you get a certification does not mean that you're going to get a job. So you want to first get the core certification, and then you want to start building your experience and building your resume so that you can get other opportunities that require you to get a certification. Because getting certifications just to get certifications and have letters behind your name is not productive if you're not earning any money to actually support those letters. So thank you for watching this video. Stay tuned for more content from Paula Anderson Coaching Consulting on medical coding.